Hospitals have also taken a hit as the pandemic forced them to cancel elective procedures, including cancer surgeries. Now several states are loosening restrictions, and not a moment too soon for patients in desperate need. Here's Katie Beck.
Cindy Knight fears that her breast cancer is spreading. Diagnosed 3 months ago, doctors ordered a double mastectomy.
I wanted it out, away, done as soon as possible, and that didn't happen.
Her procedure, scheduled in February, canceled by coronavirus restrictions because it's considered elective surgery. Not in her mind.
It was worth to you risking a COVID-19
Yes,
exposure to get this done.
Yes, it was. Other than that, I'm relatively healthy. I could have possibly fought that battle, but I wasn't given the option of doing that.
Just this week, many states across the country starting to allow elective surgery again in hospitals. Today, New York announced they'll start in facilities upstate.
When you cancel elective surgeries, hospitals feel a financial pinch.
New numbers reveal a devastating side effect of COVID-19 on hospitals. In the first quarter of the year, half of the loss in the nation's GDP came from the healthcare industry. In the month of March alone, 43,000 healthcare workers lost their jobs. Thousands of doctors and nurses furloughed by hospitals trying to cut costs to stay afloat.
We had all the expenses of caring for COVID patients, and we had no revenue coming in.
President of the American Hospital Association, Rick Pollack, says many facilities face closure.
Well, hospitals are facing perhaps the greatest financial crisis in their history.
And doctors say there are desperate patients waiting to be treated and only getting worse.
Let us be doctors. Let us make the decision as to what is necessary and what's not.
Dr. Chad Domingue owns a hospital in rural Louisiana. Since the stop on surgeries, his facility is seeing about 5% of its previous number of patients.
We're not talking about nose jobs. We're not talking about tummy tucks. We're talking about spine surgery. We're talking about heart stents.
But as surgeries return, Knight's is now rescheduled for next week. She fears plans could change.
Oh, I'm very scared. I have 2 grandchildren, 2 daughters married, and I have a lot of life left in me. I'm not ready to leave yet.
Healthcare facing new struggle while still battling a pandemic. Katie Beck, NBC News, Hammond, Louisiana.